we're looking at a very important terminology again in obstetrics, and this is what's known as the Pyosalpinx. Pyosalpinx. Now, anytime you see any terminology, I want you to always make sense out of it before you even try to discuss it. Now, as a medical student, you should try to know some basic words, right? If you see something is pyo, what does pyo means? Pyo just simply means abscess or pause. Salpinx is a trumpet. Okay, trumpet is another name for fallopian tube, because the fallopian tube looks straight, then the curved ovary side looks like a trumpet. Do you understand? So it's salpinx, right? There's inflammation of the fallopian tube. You say salpingitis. Do you understand? So pyosalpinx is just simply pus is accumulating in the fallopian tubes, mostly due to infections. All right. Then most of the times, this has come in because there was a previous history of pelvic inflammatory disease. So it's a severe form of salpingitis. So a normal inflammation of the fallopian tubes, there's no accumulation of pus, but when it gets severe, there's accumulation of pus. So, typically arise from untreated or poorly managed pelvic infections, especially the ones caused by Chlamydia, trachomatis, Neisseria, gonorrhoeae. So causes: pelvic inflammatory disease, sexually transmitted infections like the Chlamydia, trachomatis, Neisseria, gonorrhoeae, like we spoke about, and sometimes is coming in as a result of surgical complications, sadly. Okay. And sometimes you can have extra pulmonary tuberculosis spreading to other structures like the fallopian tubes too. So issues that such a person will have: there's so much pain, there's fever and chills. That's when the microorganism is getting into the bloodstream. Pain during intercourse, menstrual irregularities. Then this type of fallopian tube, of course, will not favor fertilization. Okay, so they try to give birth, there's a whole lot of issues. If I want to pick up that disease in a patient, I do pelvic examination, ultrasound and MRI, blood test, laparoscopy. Okay, so treatment: if it is caused by bacteria, you use antibiotics, right? Then sometimes if the pus is so much, you can surgically drain it. Okay, then sometimes if the tubes are affected too much, just cut them out. That's salpingectomy. Then you hospitalize the patient. Okay, so that's what we got for this Pyosalpinx and what it means.